In this video, we're going to talk about something many older adults rarely hear out loud: what doctors really think about their senior patients when the door is closed. If you're in your 60s, 70s, or 80s, this is important, because the way a doctor truly sees you can affect how much time they give you, how carefully they listen, and even the kind of treatment you receive. So stay with me, because in this video I'll share 5 surprising truths about how doctors often see older patients, and I'll give you clear steps to protect yourself. Each truth will open your eyes, and by the end, you'll feel more prepared and confident for your next visit to the doctor. Before we start, I'd love to know, where are you watching from today? Just drop your city and state in the comments below. It's always encouraging to see how many of us, all across the country, are facing the same challenges and learning together. Point 1. Doctors see seniors as complicated patients. One of the first things many doctors think when an older adult walks into the office is, this is going to be complicated. Not because you are difficult as a person, but because your health is no longer straightforward. At 70 or 80, your body processes medicine differently, your organs may not respond as quickly, and you're often taking several prescriptions at once. That means even a simple problem, like knee pain, requires more checking, more questions, and more caution. Imagine this. A younger patient comes in with knee pain. In 10 minutes, he gets a prescription and walks out the door. But when someone your age comes in with the same complaint, the doctor has to look at your blood pressure, your kidney function, your heart history, and your medications before making a safe decision. All of that takes more time. Instead of appreciating the complexity, some doctors see it as a burden. That's when you notice the sighs, the rushed answers, or the feeling that they just want to move on. But here's the truth: you are not the problem. The system is. Appointment times are short, doctors are under pressure, and seniors often pay the price. If you've ever felt brushed off or rushed out, it wasn't your imagination. Studies show older patients are given shorter visits on average than younger adults. So, what can you do? First, prepare a short list of your top 2 or 3 concerns before the appointment. That way, the most important issues don't get lost. Second, consider bringing a trusted friend or family member with you. A second voice can slow the conversation down and make sure your questions are answered. And third, don't be afraid to pause the doctor by saying, "I need a moment to understand." That one line changes the tone immediately. Your health may be complicated, yes, but your right to respect is not. Perfect thumbs up. Here's point 2 in the same warm, simple style for older adults in the US, around 300 words. Point 2, assuming seniors can't understand. Another hard truth is that some doctors quietly assume older patients can't fully understand medical information. They may think, why bother explaining in detail? It will just confuse them. This kind of thinking is unfair and dangerous. Take the example of an older woman who went to her doctor because of sudden dizziness. Instead of investigating, the doctor brushed it off, saying, "It's just age, nothing serious." A week later, she collapsed from an undiagnosed heart problem. Now compare that with a younger patient who had the exact same symptom. He was given a full workup, clear explanations, and a treatment plan. The difference was not ability, it was assumption. Here's the reality: as we age, it may take us a little longer to process new information, but comprehension remains strong. Seniors can absolutely understand complex details if they are explained clearly and respectfully. The problem is not your brain, it's the doctor's communication style. If you've ever walked out of an appointment still unsure of what the doctor meant, you are not alone. That confusion is not your fault. It happens because too many doctors use vague words like, "Don't worry, you're fine," instead of giving real answers. And when you don't have the full picture, you can't make safe, informed decisions about your health. So how can you protect yourself? First, try the teach back method. After the doctor explains something, repeat it back in your own words, so what you're saying is, this forces the doctor to confirm or clarify. Second, don't hesitate to ask, "Can you write that down for me?" or "Could you explain that in simpler words?" That is not weakness, it's wisdom. Third, keep a small notebook with you to track symptoms, questions, and answers. Remember, your right to understand your own health does not fade with age. You deserve full information, every single time. Great thumbs up. Here's point 3 in the same clear, senior-friendly style, around 300 words. Point 3, rushing through appointments. One of the most common complaints older adults share is that their doctor seems to rush them. You sit down, start explaining your problem, and before you've even finished, the doctor is already glancing at the clock or moving to the next step. It can feel like you're being pushed out of the room. Think about a man in his late 70s who went to his clinic with chest pressure. He barely got 2 minutes to describe his discomfort before the doctor ordered a quick test and moved on. Later that night, he ended up in the emergency room with a heart attack that might have been prevented if the doctor had slowed down and listened carefully. Contrast that with a woman in her mid-60s who reported the same symptoms. Her doctor took time to ask questions, listened without rushing, and caught the warning signs early. Her life was likely saved simply because she was given more attention. Why does this happen? Older patients often have multiple conditions, surgeries, or medications. Sorting through that history takes time. But instead of slowing down, many doctors speed up, assuming your discomfort is just age. The result is dangerous, missed symptoms, wrong diagnoses, or harmful drug interactions. So what can you do? First, go in prepared. Write down your top 3 concerns in order of importance. This way, even if the visit feels short, the most urgent matters get addressed. Second, bring a trusted friend or family member who can act as your advocate, reminding the doctor to slow down and really listen. Third, don't be afraid to say, "I need a few more minutes." Your time is just as valuable as anyone else's, and your health depends on being fully heard. You deserve more than a rushed visit, you deserve care that respects your story and your life. Point 4, doctors underestimating emotional health. Another hidden truth is that many doctors underestimate the importance of emotional health in older adults. Too often, they focus only on blood pressure, sugar levels, or medications, while brushing aside feelings of loneliness, grief, or sadness. But your emotions are just as important to your health as your heartbeat. Picture an older gentleman in his 80s who told his doctor he felt lonely after losing his wife. Instead of taking it seriously, the doctor quickly shifted the topic back to his lab results. Weeks later, his loneliness deepened into depression, which made his physical health spiral downward. Now compare this with a woman in her 70s who admitted feeling the same way. Her doctor connected her with a local support group and encouraged daily walks with her neighbors. That small step gave her new energy, laughter, and stability. The science is clear, emotional health and physical health are directly linked. When sadness, stress, or isolation go untreated, your body produces stress hormones that weaken immunity, increase heart risk, and disrupt sleep. Yet many doctors dismiss these concerns as just part of getting older. That attitude is not only wrong, it's harmful. If you've ever left a doctor's office feeling invisible because no one addressed your deeper worries, you know how discouraging it feels. But here's what you can do. First, speak openly. Say, "I've been feeling unusually down," or "I don't enjoy things like I used to." Second, track your mood changes just like you would your blood pressure. If you've been low for more than 2 weeks, that's a red flag. Third, ask directly, "Is there someone I can talk to, maybe a counselor or a group?" Remember, your emotional well-being is not a side issue. It is central to your health, your independence, and your quality of life. You deserve care for both your body and your spirit. Point 5, doctors undervaluing prevention. The final truth is that many doctors quietly underestimate the value of prevention once a patient reaches their 70s or 80s. Some carry the mindset, "At this age, it won't make much difference." That kind of thinking can discourage seniors from making healthy choices that actually matter a great deal. Take the story of a man in his late 70s who asked his doctor if it was still worth keeping up his daily walks and adjusting his diet. The doctor shrugged and said, "At your age, it probably won't change much." Discouraged, the man stopped walking. Within a year, he gained weight, lost energy, and became more dependent on medications. Now compare that with a woman in her mid-70s whose doctor told her, "It's never too late to invest in yourself." She kept gardening, stretching, and eating balanced meals. Today, she moves with strength and enjoys her independence. The truth is, prevention works at any age. Muscles can still grow stronger, lungs can still expand, and the heart still benefits from activity and nutrition. Studies show that seniors who stay active cut their risk of falls, heart disease, and even memory decline. Prevention is not wasted, it's power. So what can you do? First, never accept the idea that age cancels out progress. Your body may respond more slowly than when you were 40, but it still responds. Second, focus on small, steady habits, a 10-minute walk after meals, adding one more serving of vegetables, or drinking enough water each day. Third, challenge your mind with reading, puzzles, or learning something new, because mental activity is just as protective as physical movement. Prevention isn't about denying age. It's about honoring life. Every step you take now, big or small, adds strength, dignity, and years of quality living. Point 6. Doctors quietly judge quality of life. One of the most powerful truths you need to know is that some doctors quietly judge whether certain treatments are worth it for older adults. They may not say it to your face, but in their minds, they weigh your age against the effort or cost of care. This hidden bias can affect the options you're even offered. Imagine an 85-year-old man with early cancer. His doctor tells him, "At your age, aggressive treatment may not be worth it." The decision was made for him, not with him. But another patient in her 80s with the same diagnosis was given all the facts and choices. She chose a gentler treatment plan that kept her active and happy for years. The difference? One doctor judged her life as valuable enough to fight for, while the other did not. This attitude is dangerous because no chart or textbook can measure the value of your life. Only you can decide what is meaningful to you, whether that's more years, more comfort, or more independence. So how can you stand up to this hidden bias? First, always ask, what are all my options? Don't let anyone limit your choices without explanation. Second, ask, what happens if I do nothing? This helps you weigh the real risks. And third, remind your doctor, I want to be part of the decision about my care. Those words shift the power back to you. Your age does not define your worth. Your life has value, whether you are 65, 75, or 95. And no doctor should ever quietly decide that for you. Point 7. Doctors dismissing seniors' voices. One of the most powerful truths is that some doctors quietly dismiss the voices of older patients when it comes to decision-making. They may listen politely, nod their heads, and then go on to choose what they think is best for you, without truly involving you in the decision. It may not always be intentional, but it happens more often than you realize. Picture an older woman who clearly told her doctor she wanted to avoid surgery and explore safer, non-invasive options first. Instead, the doctor scheduled her for surgery, saying, "Trust me, this is what you need." Her wishes were ignored. Now compare that with another senior who faced the same problem. Her doctor slowed down, explained every option, and allowed her to decide based on her values. She felt respected, and her care matched her goals. The truth is, you are the expert on your own life. Doctors may have the medical knowledge, but only you know what matters most, whether that's comfort, independence, or more time with loved ones. When your voice is ignored, it strips you of dignity and choice. So what can you do? First, state your goals at the beginning of the visit. My priority is to stay independent, or I want comfort over aggressive treatments. Second, ask directly, what are the alternatives, and what would you recommend if you were in my position? Third, never be afraid to say, I want to be part of this decision. Your age does not silence your right to decide. Your voice matters, and when you use it, you take back control of your health and your future. We've uncovered 7 eye-opening truths about how some doctors really see older adults. They may view you as complicated, assume you won't understand, rush through your appointment, ignore your emotional struggles, undervalue prevention, or even quietly decide how much your life is worth. Each of these attitudes can quietly chip away at your dignity, independence, and health. But here's what I want you to remember: you are not powerless. You have the right to ask questions, to demand clear answers, and to make your own choices about your health. Aging does not erase your voice. In fact, it makes your experience and perspective more valuable. Think back to the stories we've shared. One senior was brushed off, and his health suffered. Another spoke up, asked questions, and got the care that saved her life. The difference was not luck, it was self-advocacy. You can do the same. So here's what I encourage you to do right now. Write down one question you will bring to your next doctor's visit and don't leave until it's answered. Choose one small habit of prevention, like a short daily walk, a healthier meal, or staying socially connected. And most importantly, remind yourself every day, your health matters, your feelings matter, and your voice matters. If you found this video helpful, please take a moment to like it, subscribe, and share it with someone who might need this encouragement. And tell us in the comments, what's one step you'll take to make sure your voice is heard at your next doctor's appointment? Aging is not about giving up. It's about stepping forward with strength, wisdom, and dignity. And you deserve nothing less.